My name is Florence Mendoza, and today I'll be presenting my career symposium and is on physician assistant. Physician assistant is a licensed medical professional who works as part of the healthcare team to examine, diagnose, and treat patients. My presentation will cover the education and the experience requires schedule, the certification, the continuing education, the salary, the job outlook, and the future direction, and how the careers connects to what we learn in class for a physician assistant. So the responsibilities for a physician assistant is to examine, diagnose, and treat patients under a physician supervision or a doctor. Also, a physician assistant is a medical professional who can perform physical exam, obtain medical history, diagnose and treat illnesses or injuries, or interpreting testings, and prescribe medication, and assisting in procedure and surgery with the doctors. And also, this PA always work with like with the physician, but like sometimes they do need their independency, so they work independently in patient care. So to become a physician assistant, you must complete a bachelor degree, which usually is with the science prerequisites like biology, physics, chemistry, anatomy, physiology. After that, you must get accepted in a master level PA program by ARCPA, which stands for Accelerated Review Commission Physician Assistant. And also, you must gain some patient care experience, like working in the healthcare patient care or shadowing. And also, you must pass your PANCE, which is Physician Assistant National Certifying Examination. That's right there too. And how competitive is a PA program? So we're looking at is very high competitive with the national rate of 7%. The GPA in the GPA has to be at least overall to be 3.6 overall. So you must get accepted. You must have a good GPA, and you must have a good 3.5 GPA in science courses. I'll say PA school usually takes about 2 or 3 years and includes both classroom learning and clinical rotation, like an area like in family medicine, surgery, and emergency medicine. So the cost of education is it looks like so there is a significant financial investment you have to put in there. The average total PA program costs are around in state is about 98,000 total, 98,000. And in out of state it's about $107,000 in total or more per year, like per year estimate. So public and state is 31,000 per year. And then for public is 56,000. So for private, both of them looking around like 65,000 more per year. Because of this, many PA student relies on financial aid, loans, and scholarships, or working in healthcare beforehand. Most PA's program wants applicants to have hands-on patient care experience before applying. The most job you can get your experience from is from EMT, paramedic, certified nursing assistant, medical assistant, nurse, lab assistant, and rehab tech. Most programs requires 100 to 1,000 hours of clinical rotation, and also this experience helps the PA to learn to communicate with patients, take vital signs, and understand basic medical procedure before starting advanced training. So, what is the certification and continuing education credits? Certification. So after you graduate from PA school, student must pass the PANCE and to become a certified PA. PA are also licensed by the state where they work in. Is there continuing education credits? Yes, they do. PA must complete 100 hours of continuing medical education (EMC) every 2 years. They must take the rear certification exam, which currently is every 10 years. This ensures PA to stay up on date on new treatment, on my bad, on new treatments medication, and medical guidelines. So a PA schedule depends on the setting and specialty. A clinical or primary care PA often works regular hours like Monday to Fridays, let's say 8 to 5 p.m. In hospitals, ER, and urgent care, they might work more on demanding 12-hour shifts, nights, weekends, and holidays. Many PAs work around 40 hours per week, and some might work more if they take extra shifts. So, for example, in working for hospitals, they might mix of day and night schedule like 12-hour shift and might require working every third weekend. What might affect the schedule is depending on the holidays, on-call duties, administrative tasks, and shift lengths. So physician assistants are generally well paid compared to many other careers. Starting salary range are roughly around 8,000 to 100,000 range, and depending on the state and specialty. With experience or in higher pay specialty, salaries can raise up to 120,000 to $160,000 or more. Most PA are paid on salary based. Through some may have hourly pay or bonus for extra shift. Factors that may affect pay might be location, specialty, year of experience, and the type of employer, like hospital versus clinical versus private practice. Looking at the chart, here are the two that similar options and related discipline. So a nursing practitioner works independently in some state, focus on patient population, follows the nursing models, start as an RN and take the NCLEX and earns a MSN and a D or a DNP. Physician assistant works under a supervision of a physician, works focused on medical specialties, and follows on medical models, follows the general medical path, and the PANSI exam. But both of them provides direct patient care, diagnose and treat and prescribe medicine, requires advanced medical training, requires license, requires a license, work in various healthcare settings, and earns competitive salary with a strong job growth. The job outlook for a PA is very strong. According to the workforce projection, PA employment is expected to grow much faster than average over the next decade. This growth is due to the precision storage in many areas, a aging population needs more healthcare, and also PA being a cost-effective provider for many medical service. There are expected to be 1,000 of new PAs job offer each year. Overall, PA is considered a high demand stable career, and it increased by 20%, which creates by a 12,000 job opening annually for PA. And that's a good sign for us. If anyone was interested in PA, go for it. Is there future direction as a physician assistant? Yes, there is. Physician assistant can have expand scope of practice in some state, take on many more leadership roles in healthcare teams and clinics. Be a more involved in telemedicine and virtual care, and also specialize in more fields like surgery, emergency medicine, and orthopedics. As healthcare keeps changing throughout the years, PA will likely play a bigger role in primary care in areas with fewer positions. This shows that the PA is not only a good job now, but also a growing career for the future, and it will help you grow with their education later on in the future too. In exercise testing and prescription, known as clinical exercise physiology, really help body response to exercise and physical stress. So they have rehabilitation and recovery, patient monitoring and assessment, health counseling, and disease prevention and management. And this is knowledge is important when we're treating patients with heart disease, diabetes, and obese or lung disease. Design or approve safe exercise program for people with medical conditions, and also understanding vital signs, VO2 max, and other testing results from exercise testing. PA used this information to help patients improve fitness, manage with chronic disease, and reduce health risks through the exercise and lifestyle change. So for biomechanic, which is also known as motor behaviors, we help understand how people move and control their bodies. So they have developed clinical skills, patient education and training, physical and neurological assessment, and for referrals and treatment plan for moderate impairment. So for this connects evaluating movement pattern, posture, and gait after a injury or surgery, teaching patient proper body mechanicals like how to bend, lift, carry without hurting your back. Working with rehab team like PT, OT, or trainers to help patients return to their daily activity or sport. Understanding motor behaviors helps PA prevent injuries, improves functional moments, and supports safe return to activities. Fun facts about physician assistant is the profession was created in 1960 to address a shortage of doctors, which is very interesting. When I looked that up, I was like, wow, I didn't know that. And then with thanks to the profession, it helped a lot of doctors throughout their career, so which is very good. Also, physician assistant are highly trained with master degree, which is very good to know too. And also, physician assistant gets over 2,000 hours of clinical rotation, which helps them to get more hours in patient care to help they get to their real world job. Like whenever wherever they work, they have a lot of hands on to do, a lot of hands on care to do. Here are my sources. So all my sources this slide and there's a next slide that's my sources. So I will show you there too. All sources I follow too. I did all there should be all APA format. So here are my sources. So before I leave today with this presentation, I wanted to tell you my conclusion about physician assistant. I am very interested in this career actually because I want to work directly with patients, help diagnose and treat health problems, and be part of a team that improves people's quality of life. And thanks to this presentation, I really learned how precision assistant are. But thank you for this presentation. Thank you for listening to me. And my name is Florence Mendoza, and hopefully you like this presentation. Bye.